Bonjour. Welcome back to Inside Insights. I'm Chip Truitt, Chief Medical Officer of Precision Diagnosis at Philips. Today on Inside Insights, we're going to take a bit of a dive into Lumify, powered by Reax. The Lumify solution brings precision diagnosis directly to the patient, offering incredible flexibility to providers. Coupled with the Reax collaborative platform, this integrated tele-ultrasound approach enables less experienced clinicians, trainees, or other healthcare professionals like paramedics or midwives performing a point-of-care ultrasound exam to be backed up by experts anywhere in the world. Joining us today is Yanick Beaulieu, Head of Clinical Science, Ultrasound, Precision Diagnosis at Philips. Welcome, Yanick.
Hey, thanks, Chip. Really glad to be here today.
Très bien. Yanick, you're both a cardiologist and a critical care specialist. Still practicing 1 week a month, I think. Lumify with Reax is helping to democratize imaging by bringing integrated tele-ultrasound capabilities to POCUS, or point-of-care ultrasound. Can you share with us your first-hand experience as well as perhaps what you've seen with other clinicians, trainees, students, and the like, as they've started to leverage Lumify and Reax?
Yes, so you're totally correct, Chip. I'm still practicing cardiology, critical care, and echocardiography, and this, in fact, enables me on a daily basis to see the benefits of bringing to the patient and to the clinician the integrated tele-ultrasound approach of Reax with Lumify. Every day we have examples of how this is benefiting both the clinician and the patient. And, I can give you, for example, recently we had a patient who was an organ donor after, unfortunately, a car accident. And he was selected as being a potential heart donor. Everything was going well until at night, one of the cardiologists on the transplant side said, hey, I need another ultrasound exam to make sure the heart function remained good. But no one was at the hospital to be able to do it now to make sure that the process would keep going on. And there was a life at the other end, waiting for that heart. So the intensivist on call, who's pretty good at ultrasound, but maybe not good enough to make sure that, he certifies that the function is good and all of that, was able to just get in, power the Lumify, connect with one of the remote cardiologists, and then just go through the basic exam to be able to make sure that he was showing the live clips, showing that the heart was still very good, systolic, right, and left ventricular function. And then, boom, the process kept going. Everything went well, and the patient got his heart the next day. So those are the kinds of situations that it just enables you taking the device, firing it up, and then communicating right on the spot with a high-quality, live, integrated tele-ultrasound experience. So this is an example where you can really not only have this for point of care, but any situation, including cardiology situation, radiology, obstetrics, where you need to have a less experienced provider communicating with a more expert provider, taking the device and being able to do this just in a few seconds, in fact.
That's fabulous, Yanick. Thank you for sharing what is a tragic story, but with hopefully a positive outcome. And I suspect that this trend of this kind of story with the Lumify is going to continue, but it's likely to explode at an exponential rate, partly because of the versatility of this technology, but also because of the price point. I also wonder, medical students used to all purchase a stethoscope when you and I were medical students. And then perhaps we graduated to the digital stethoscope. And while I'm not expecting students to purchase a Lumify, I could easily see medical school foundations raising funds for such a program to equip medical students with a Lumify on the way out their door towards clinical practice. What do you think?
Yes, totally. This is completely in line with what has been happening for the last few years, where different programs, either medical schools, professional organization, or institutions have started those kinds of programs where they try to get as much funding as possible to buy ultrasound systems so that the medical students and junior residents can have a longitudinal training. So not just doing, some focused training during 2 days in a hotel during a weekend. They really want to bring the system so that people can use it, become competent, and remain competent even before they start their residency, specialty, or family medicine residency. So we see this happening. And in the context of, we've been talking about the use of the handheld ultrasound as, to kind of replace or strongly complement the stethoscope for many years. In the context of COVID, because we, in many cases, cannot use our stethoscope for, all the reasons where we don't want to be a vector and get the stethoscope on all patients in the hospital. This is really where all the significance of using point-of-care ultrasound to kind of replace the stethoscope to assess the heart, the lungs, the abdomen, really took all of its essence. So I think that now with a lot of those programs being put in place, the indications had been there, but now they've just been skyrocketed to see that this needs to be implemented. So I think we'll see more and more of those. And already, within Philips, we have more and more of those partnerships that are being designed, that are evolving exactly to push that concept. So I think it will be very beneficial for the med students and junior residents.
Thank you for sharing that. And I actually had a question I no longer need to ask you, and that was about COVID in light of the upcoming potential approvals. And we know that it's going to be a good 6 months after approved before non-medical personnel can have access to the vaccines. But in the meantime, staff, nurses, and physicians are all going to need to continue to do their work, and having POCUS or point-of-care ultrasound with Lumify is going to be huge to keep people safe. So another area that I think is worth delving into is that, as you know, healthcare is increasingly leaving the walls of the hospital, and in fact leaving the walls of the doctor's office now with tele visits and the like. And it's now being delivered at home. So do you envision the time where ultrasound will follow suit, presumably in situations where patients with specific diseases or conditions that need follow-up care can leverage a handheld ultrasound, perhaps with AI capabilities on top of that, to essentially direct the acquisition of imaging with reproducibility that they can share with their clinician?
Absolutely. I think that the important thing here, the technology, obviously, even today, is totally adequate in order to be able to do that. What is important is, okay, who's going to be doing what kind of training will need to be, will be required. And I give you an example. You have a patient with chronic heart failure, and you have one of the significant other, the wife, the son, the cousin, whoever can be on site with the patient and use the ultrasound. For example, look at the lung to see if the lungs seem to be congested. Maybe that combined with what's happening clinically, the ultrasound findings that can be either sent asynchronously or through a live communication with integrated tele-ultrasound. The physician remotely may say, oh, it looks like you're, gaining some weight. You have evidence of fluid on your lungs. So let's increase your diuretic dose, or come and see me in the office. Or your lungs look totally dry, seems okay, keep doing this. So the idea here is not to try to have patients or their relatives become an echocardiographer or general ultrasonographer specialist, but to use the systems for focused application that can have tremendous value in keeping patients at home. And another of these indications could be with the obstetrics patients, where, they may want to know, okay, is my baby well positioned? Is there something as it relates to the quantity of amniotic fluid or any other thing that could be worrisome? So people are talking, can they learn doing it themselves? Not impossible. We just need to see, is it better someone being trained with someone live guiding them and getting the results and see what can be done with it? Or is it the midwife coming at home, or a sonographer that goes at home from different? So there are all kinds of scenarios in which bringing handheld ultrasound at home will be totally feasible. It just needs to be, well determined on how it's brought so that it's safe for the provider, for the patients. But ultimately, this is where it will be going. So we're very interested at Philips in moving in this direction.
That's a great answer. Now, you raised an interesting question here because you used a big word, asynchronously. So I want to take a moment to delve into that. I think many of us know what you mean, but maybe for everybody's benefit, you could explain that perhaps for obstetrics, there's no urgency that you send the image right away. Perhaps for a home echo or something, if somebody's having pain at the moment, you would want to have the image immediately. Can you explain for everybody what you mean by synchronous and asynchronous transmission?
Certainly. So as you pointed out very clearly, there are conditions. I give you an example for the obstetric patient. maybe eventually we could think of a protocol where once a week or once every 2 weeks, one of the relative does a specific scanning sequence of 3 different planes, and the obstetrician may not be available at the same time as the exam is performed. So they could use what we call asynchronous or not live. So they would send the images through a secure portal, so that at the time that the radiologist or obstetrician is available, they can look at them and then get back to the patient. So it's a different point in time, a bit like when we send a text message or email where whenever the person at the other end has time, they can reply. Compared to the synchronous or live aspect, exactly as you mentioned, if someone needs to really see or be guided by the expert live, then they need to connect. And this is where the integrated tele-ultrasound component is key, to be able to have this live interaction, which is synchronous between the expert and either the patient or the relative performing the exam.
That is terrific. Thank you for explaining that and giving such beautiful examples for everybody. I think it's really one of the highlights of what you've brought to the platform with the REACT's backbone there for collaboration. So let's switch gears. I mentioned AI a moment ago. A lot of people are talking about AI for optimizing or improving workflow, for improving the image quality, for improving the ability to make or confirm a diagnosis. I think in ultrasound in particular, where the image plane, the orientation, training someone or teaching someone that is not an expert on how to position the probe is going to be key, as you've mentioned before. So can you share with us how you see AI impacting the benefits of handheld ultrasound in the coming years and perhaps evolving over the next 10 years?
Yeah, so I think the potential of AI in what you mentioned is important. So first, I think there's the component about image acquisition, which is the biggest challenge for anyone starting to use point-of-care ultrasound, where they need to have, there's no other way but doing it to really have the hand-eye coordination. And in order to verticalize that curve of learning, being able to add some AI assistance and algorithms that can recognize when the person is scanning if the plane of cut is adequate, too much to the right, too much to the left, rotate, open up. So all of this, there's a significant place for AI to be able to enhance image acquisition, the learning of image acquisition in a faster way and in a kind of a virtual self kind of learning that can really be significant. That being said, this should be complemented by the live component of the training and interaction with the trainer. So AI on its own, I don't believe will take care of everything we need. It needs to be combined with this relationship with the trainer or with the live expertise that can combine with what brings AI. The second component of AI then will be on helping out to make workflow more efficient, to make image capture more efficient, and to decrease the number of calculation we need to manually do. And there are things, for example, being able to have an auto ejection fraction in the intensive care. If you just put the probe, do the right views, and boom, it gives it for you. It will allow you to have a faster, more accurate way of assessing and following the patients. So I think AI really has roles in all of those dimensions, but we always have to remain careful about the quality of the data, how it's processed, what are the algorithms, but appropriately deployed and implemented, it will have a huge impact, not only now in the next few months, but over the next 5 to 10 years.
Yanick, thank you so much for that beautiful explanation of where you think we're going to be going. And thank you so much for joining me today. I think this has been a terrific discussion. J'espère. Thanks so much, everybody, for listening. Yanick, thank you so much for joining us today.
Thank you. It was a great pleasure.